I tried steroids, I tried antibiotics, I tried drawing salves.
Switch soaps, I would not do any dairy.
I did all the things that all the doctors and dermatologists told me that I should try.
Yeah, the list is just never ending.
I still have scars to this day from things that I treated on my own.
I did not know that untreated abscesses could lead to tunneling. The way that you look at yourself, the way that you fear others might look at you, I don't know, it's just so much more impactful than just being on the surface.
I felt like I was suffering for probably about 5 years with HS before doctors finally found something that worked for me.
When I walked in, they were like, hey, there's biologics for that. And I was like, I don't know what that is.
My dermatologist told me about Cosentyx for the first time. She told me all the benefits of it. She told me that she had other patients that had tried it and they loved it. She talked about a little bit of the side effects, but I think because my dermatologist was so knowledgeable, not only about Cosentyx, she was knowledgeable about my body.
You have to be able to be open with who you're seeing to share what you're genuinely feeling.
To know that I could have long-lasting relief from my symptoms was something that I never knew.
When I found the dermatologist that I see now, it was a world of difference. She let me know that it was okay, and this isn't something that I caused, but this is what we're gonna do to help resolve it.
I started taking Cosentyx, and it was like a light bulb went off in my body.
I wish that I would have known that you can go to the doctor and have abscesses treated sooner so they don't become a larger problem.
Indications. Cosentyx, secukinumab, is a prescription medicine used to treat people 6 years of age and older with moderate to severe plaque psoriasis, PSO, that involves large areas or many areas of the body, and who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet or UV light alone, or with systemic therapy. People 2 years of age and older with active psoriatic arthritis, PSA, adults with active ankylosing spondylitis, AS, adults with active non-radiographic axial spondyloarthritis, NRXPA, and objective signs of inflammation. People 4 years of age and older with active enthesitis-related arthritis, ERA, adults with moderate to severe hidradenitis suppurativa, HS. Important safety information. Do not use Cosentyx if you have had a severe allergic reaction to secukinumab or any of the other ingredients in Cosentyx. See the medication guide for a complete list of ingredients. What is the most important information I should know about Cosentyx? Cosentyx is a medicine that affects your immune system. Cosentyx may increase your risk of having serious side effects, such as infections. Cosentyx may lower the ability of your immune system to fight infections and may increase your risk of infections. Some people have had serious infections while taking Cosentyx, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses. Some people have died from these infections. Your doctor should check you for TB before starting treatment with Cosentyx. If your doctor feels that you are at risk for TB, you may be treated with medicine for TB before you begin treatment with Cosentyx and during treatment with Cosentyx. Your doctor should watch you closely for signs and symptoms of TB during treatment with Cosentyx. Do not use Cosentyx if you have an active TB infection.
Before starting Cosentyx, tell your doctor if you are being treated for an infection, have an infection that does not go away or that keeps coming back, have TB or have been in close contact with someone with TB, think you have an infection or have symptoms of an infection such as fevers, sweats or chills, muscle aches, cough, shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate, or urinate more often than normal. After starting Cosentyx, call your doctor right away if you have any signs of infection listed above. Do not use Cosentyx if you have any signs of infection, unless you are instructed to by your doctor. What are the possible side effects of Cosentyx? Cosentyx may cause serious side effects, including serious allergic reactions. Serious allergic reactions can occur. Get emergency medical help right away if you get any of the following symptoms: feeling faint, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash or hives, red itchy bumps. If you have a severe allergic reaction, do not give another injection of Cosentyx. Inflammatory bowel disease. New cases of inflammatory bowel disease or flare-ups can happen with Cosentyx and can sometimes be serious. If you have inflammatory bowel disease, ulcerative colitis, or Crohn's disease, tell your doctor if you have worsening disease symptoms during treatment with Cosentyx or develop new symptoms of stomach pain or diarrhea. Severe skin reactions that look like eczema can happen during treatment with Cosentyx from days to months after your first dose and can sometimes lead to hospitalization. Your doctor may temporarily stop treatment with Cosentyx if you develop severe skin reactions. Tell your doctor if you have any of the following signs or symptoms: redness or rash, itching, small bumps or patches, your skin is dry or feels like leather, blisters on the hands or feet that ooze or become crusty, or skin peeling. The most common side effects of Cosentyx include cold symptoms, diarrhea, and upper respiratory tract infections. These are not all of the possible side effects of Cosentyx. Call your doctor for medical advice about side effects. Before using Cosentyx, tell your doctor if you have any of the conditions or symptoms listed above for infections. Have inflammatory bowel disease, Crohn's disease, or ulcerative colitis. Are allergic to latex. The needle cap on the Cosentyx Senza-Ready pen and 150 mg per milliliter and 75 mg per 0.5 milliliter pre-filled syringes contains latex. Have recently received or are scheduled to receive an immunization, vaccine. People who take Cosentyx should not receive live vaccines. Children should be brought up to date with all vaccines before starting Cosentyx. Have any other medical conditions and all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Keep a list of your medicines to show your healthcare provider and pharmacist when you get a new medicine. Are pregnant or plan to become pregnant? It is not known if Cosentyx can harm your unborn baby. You and your doctor should decide if you will use Cosentyx. Are breastfeeding or plan to breastfeed? It is not known if Cosentyx passes into your breast milk. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide.